Hi, everybody. I'm Jeanne E. Poole. I am the editor-in-chief of the Heart Rhythm O2 Journal, and I'm here with my two guests today, Dr. Robert Hauser, from the Minneapolis Heart Institute Foundation, and Dr. Michael Gold of the Medical College of South Carolina. Welcome to both of you, and thank you so much for spending the next 10 or so minutes with me to discuss this important topic of device advisories. Dr. Hauser, you've been just this clarion call for us to dig deeper into some of these advisories and have really helped the EP community understand what the issues are and the potential risks. And you recently published a paper, thank you very much, in Heart Rhythm O2 that was titled Safety of the Pacemaker Mode Intended to Protect Patients. So quite an interesting, maybe provocative title. But before we get into the paper, let me just kind of set the stage for our audience about what we're talking about here. So in June of 2021, there was an advisory issued for the subset of the Boston Scientific papers, the Ingenio series and others, that there was a high internal battery impedance that was occurring in a subset of these towards the end of battery life that would then trigger early battery depletion and require intervening with early generator replacement. And then in 2024, another advisory was issued again for a high battery impedance of a certain series, primarily of the Accolade family of pacemakers. And that was for devices that were built before September of 2018. So the cost for the high internal battery impedance, I believe, was different for these two advisories. In the earlier devices, the Ingenio, etc. series, that was related to insufficient electrolytes from latent absorption, whereas in the latter group, so the Accolade and related series, it was due to a higher concentration of lithium salts in the battery cathode. But either way, the problem was that when the battery impedance increased, that would trip an error code, resulting in the device switching to something called safety mode. So Dr. Hauser, maybe you can explain to us a bit about what safety mode is in the Boston Scientific devices, what it had to do with this battery impedance advisory, and specifically what your study was about.
Thank you, Dr. Poole. All pacemakers have backup reset or safety modes that are intended to preserve basic pacing functions in the event of a catastrophic failure due to a battery, electronics, or lead problem. The settings are typically VVI or BVI, high output, and unipolar. Now, Boston Scientific safety mode, unlike the other three manufacturers, has an unusually high sensitivity, auto gain at 1/4 millivolt, 0.25 millivolts. So it readily senses low amplitude signals like myopotentials, EMI, and electrogram noise. The result of this oversensing is pacing inhibition and asystole in patients with no underlying rhythm. Once the pacemaker is in safety mode, it cannot be programmed, and it has no magnet response. The only recourse is generator replacement. And of course, this can be a problem. As Dr. Poole just mentioned, in 2021 and again in 2024, Boston Scientific issued recalls for battery problems that could trigger the safety mode, particularly during high-power operations such as telemetry. Now, there are two case studies published in Heart Rhythm that reported patients who had syncope when their Boston Scientific Ingenio pacemakers reverted to safety mode due to high battery impedance. In JACC in January of this year, Colrin and her co-workers detailed 15 major complications, including 2 deaths due to Boston Scientific safety mode in their Veterans Administration study. Now, recently, as Dr. Poole mentioned, we reported the results of our MOD study in Heart Rhythm O2. We looked at all the manufacturers. Altogether, there were 1,379 symptomatic reversions, and 79% of them were Boston Scientific's pacemakers in safety mode. A third of the patients in safety mode had syncope. Some fell and suffered fractures or head injuries. Others and 80% of the safety modes were caused by high battery impedance. Now, importantly, 20% of the safety mode cases were due to other problems, not related to the battery, and these were particularly memory errors not covered by the recall notices. Safety mode commonly occurs during high-power telemetry interrogation that repeatedly trips a reset. Many patients have become syncopal in this setting, and this often occurs in the clinic or remotely. The company has recently issued a software fix, but it has been revised and does not address all the causes of safety mode. Every patient with a Boston Scientific pacemaker should be assessed for the risk of a catastrophic clinical event if safety mode occurs. The highest risk patients, in my view, are the frail elderly who are pacer dependent and often anticoagulated. Prophylactic replacement should be considered in these cases. Now, it also should be mentioned that safety mode is present in Boston Scientific ICDs, and we have found inappropriate shocks in the MAUDE database. Lastly, I'd point out that MAUDE has been shown to be useful for identifying adverse events. We first used MAUDE in 2007 to identify the Sprint Fidelis ICD lead problem. In the case of safety mode, when the first case report was published in 2022, MAUDE already had 150 adverse events involving safety mode in its database, all filed by the manufacturer. MAUDE typically surfaces a problem months before it is recognized clinically and often years before the manufacturer issues a recall notification. However, we know it cannot be used to determine incidence or rates.
Well, I think I might have mentioned to one of you or both of you at some point in time, I don't recall, but I actually had the experience of safety mode. This was a long time ago, though, and I don't recall what the exact situation was. I just remember it was very scary being in a procedure room and then having taken the generator out of the pocket and the device had reverted to safety mode, and the patient was pacer dependent and then lost capture with put the device back in. But the Boston Scientific rep helping us at the time knew exactly what it was, and went to get a new generator. It was the first time I was introduced to this problem, which is not a software problem. It's a hard safety mode is a hardware feature. And that is different from some of the other companies' backup or reset modes, isn't it?
Right, and that's I think that's a very important aspect, Jeannie. So the question is, a hardware, when it's a hardware feature, it's separate from everything else. So basically the pacemaker or defibrillator can't brick, so to speak. It can't go completely out. Whereas if it's a firmware, then that can possibly happen. So I don't know what all the other companies do, and I don't know. It's one of the issues we have with, again, we can't calculate percentages or other things since we don't have a denominator. But I don't know if it makes the Boston more susceptible to be getting those episodes recorded and in other devices, because it happens in the firmware system. It may not be seen as the same problem. I don't know that.
It could also be the
firmware everywhere else. So
yeah, it could also be the automatic programming, though, right? That it reverts to is different.
They also what's different in them. I think almost all the devices tend to go to a VVI sort of mode. What's different, and I think the biggest issue once it happens in the Boston device is that 0.25 cutoff for them. So that's certainly that's problematic. But it's really hard, at least for me, to be able to discern if a different company is using firmware or any of the firmware problems, not counted in these counts. And I don't know how you figure that out. I don't know how you figure out a denominator. Clearly there's a problem. Clearly it was very important to identify this problem. Clearly it was critically important to come up with solutions for that problem. But trying to quantify it is where I think many people struggle.
Yeah. And the solution, if I understand this correct, I mean, you can't get rid of the safety mode. It's hard baked into the devices. So if I understand it very superficially, perhaps, is that the monitoring of the battery impedance after a wireless interrogation will hold for about 4 days before declaring whether or not the battery impedance is too high or not, allowing that battery impedance to come down. And then if it hasn't come down and staying high, it does send an alert, but doesn't revert it to safety mode. Is that correct, Dr. Hauser? Your understanding of that?
I really don't know. I have talked to the manufacturer. I have talked to all the manufacturers about their reset or backup modes, and it's very difficult to understand precisely what is happening in a particular model because it varies from model to model. The backup modes in other manufacturers can be reversed, so they must be software-based in certain circumstances. But I think this is a very, very difficult problem for the mass of users think of all the people. There are 2 million of these devices out there, and they're being followed in remote clinics and small practices and so forth. And due to the complexity of this issue, I don't know how you can approach it and feel good about the care you're providing your patient.
Now, it has been mostly seen in the extended battery longevity generators, right? The ones that are supposed to last, 14 years versus 10 years.
Yes.
That's from my understanding anyway. Well, Michael, this is such an important issue. And I feel like, we get the letters that come out from the companies, the Dear Doctor letters. And I feel like multiple times per year, we're getting advisories or notices. It must be overwhelming to people that don't have access to talk to experts as readily, as we do. And it may be that these issues, either get ignored or it becomes so burdensome for the remote clinics, especially in certain areas, to try to keep up with all of this. What do we do about this? What's the big picture here?
Well, I agree that it's a major issue. It's, what we see now in completely different venue, completely different problem is with people who have wearable watches and they come and tell you all the time, I have atrial fibrillation. My watch told me I have atrial fibrillation. And, the number of false positives with that's enormous, but you don't tell patients not to look at their watches. It's a screening tool. And I see MAUD in many ways as somewhat similar. I mean, more detailed than that in some ways. But in MAUD, we don't know precisely what's going on, nor do we know how big a problem that really is for things. So I think MAUD is great that it identifies things, but I think we need a more rigorous system in which when MAUD or whatever we're using to identify this identifies it soon, that the FDA or someone has to intervene with the companies to decide, what's the problem and how we're going to deal with this and how quickly can we deal with this. So I think that's where, in my mind, things start to fall apart because there isn't enough Bob Hausers in the world who are looking at enough MAUD databases to know when do we cross a threshold. So there has to be some threshold in my mind that has to be an alarm telling people there's something potentially going on here. This has to be figured out, and it's got to be overseen by someone other than just the manufacturer.
What do you think, Dr. Hauser? What do we need to do better?
Well, just a little bit of history. I was at the first meeting of the North American Society of Pacing and Electrophysiology, which, of course, was the predecessor to the Heart Rhythm Society. And we actually held that meeting because we were having terrible reliability problems with pacemakers. And we wanted to get together and create an organization that would address this issue. And that was back in 1979. And we are no closer to a solution today than we were back then. I think this is a major issue that the Heart Rhythm Society should get behind. We should be working with the manufacturers and with the FDA. Just as Dr. Gold said, we need incident numbers, we need rates, we need to have a eye on what is happening and an early warning system, if you will.
And we need to really find a way to communicate better to the people that are actually doing all of these device checks, which are our nurses in clinic, and then, of course, our remote clinics. At least in our system, they do flag any devices that have any kind of advisory or recall, but I'm not sure that any of them, very few of them would understand what the potential consequences of any of these individual and company-specific advisories.
And it's also unusual a bit in this one is that this is a pulse generator battery problem. The number of lead problems, orders of magnitude exceed the number of times a pulse generator has its problem. So these are big problems, and these are very, very common problems that we definitely need to be dealing with and addressing soon, because we start getting at the lead problems and then it's enormous.
Yeah.
Agreed.
Well, any final comments here? I think this has been a great conversation. Clearly, there's concern amongst many of us as to whether we're doing enough. And, what, as you said, Dr. Hauser, the society can do to help us try to come up with an organized and unified way to address these advisories and recalls. I don't know how our partners in, out in private practice feel about all of this and how they're able to keep up with it. And again, because it feels like, every couple of months there's a new advisory. Unfortunately, many of them don't rise to perhaps the level of concern as this particular one.
Well, the Heart Rhythm Society needs to pay more attention to devices. I think if you attended the last meeting, you know what the emphasis was. It was on atrial fibrillation and mapping and so forth. And that's right, that it should happen, but we need to refocus on devices because we are using so many of them.
Absolutely. Any final thoughts from either of you or messages to our listeners?
This has been great. Thank you for having me.
I agree. It's a good experience. And again, I think we got to get the regulatory agencies engaged with this, which HRS is the right venue to approach them. But, industry alone is probably not going to be the solution.
No, definitely not.
Yeah, I think we all agree on that. All right. Well, listen, thank you so much, both of you, for joining me today. It was a great conversation and certainly gives us a concern regarding, one half of our types of pacemakers and one half of the types of EP studies or EP procedures that we do. So it's a big deal. And hopefully we can try to gather the right people together and think about a new way to address this. So have a wonderful day, all of you.